You're very welcome to today's episode of Skin Deep by Karina Tolan. We are here again in my home and it is just and actually I'm really loving this format, so we may be getting more of that. So I want to use this opportunity where it's just me to speak with you guys about what's blowing my mind in the skincare industry right now. And we have a new treatment that just launched in our clinics, Monica Tolan, the skin expert, Balbriggan, Malahide, both Dublin clinics and our London clinic, and it is blowing my mind. Now I'm almost 30 years in this industry, so imagine working in an industry almost 30 years and you still get your mind blown, and that's exactly why I am still here and still in love with my work and what I do every day. It's such a joy. So I want to speak to you more about the TCA treatment. So TCA is not new to Environ Skincare. In actual fact, they've been working with it for a long time. It only just launched in the UK and Ireland in September. So we are very, very excited obviously to work with it. And so far it has literally blown my mind. I've had 2 treatments done and I've already done for clients their second round, and after even 1 treatment the results are incredible. So I'm going to dive deeper into that shortly, but beforehand, and I have my notes here because it's still new to me, I want to just talk about the history of peeling and how it all originated, because I think, you know, for you to realize and see how far we have come, you must appreciate what we or our forefathers had to go through to get us where we are today. So peeling has been around for hundreds of years. Like in Egyptian times, they were known to use acids on their skin. The reason why Cleopatra would have bathed in milk is the effects of lactic acid on their skin. And then there's a type of peel called a phenol peel. Now the reason why I'm bringing that up with you today is because phenol peels are kind of a buzz right now on TikTok, etc. So they really, I mean, they're very, very aggressive, very, very aggressive to have done. And in actual fact, you have to have a heart monitor on you when you're having a phenol peel because it could kill you. And the downtime is horrific. Like, you'd have to shut yourself off for weeks. And even at that, when the outcome is good, yes, you get a whole regeneration of skin, but the skin is actually very waxy. It's almost like scar tissue, almost like a wax museum doll, the appearance, which is not ideal and not what we want. And there's a lot of complications with that type of peel. Not that you would ever be or I would ever be performing treatments like that, but that's what I wanted to give you a little bit of history into peeling and how a lot of complications can occur. A lot of it can be very, very uncomfortable and painful. The healing can be slow, obviously depending on the health of the skin going into the peel. Hyperpigmentation can occur, or even worse again, hypopigmentation, which is a whitening of the skin where the melanocyte actually dies, and very little can be done about that. And then, of course, permanent scarring really can occur as well from these more aggressive peels. So traditionally TCA would have been a high acid and a low pH peel as well. So it would have also traditionally been known in the industry as being quite a harsh peel on the skin. But what Dr. Des Fernandez and the team at Environ Skincare have done is quite phenomenal. So what they have done with these TCAs that they have brought to market for us to use in clinic, they have a gel and they have a cream. 2 different approaches, and both act as a cooling system on the skin. So what's blowing my mind with these treatments is how phenomenally relaxing and therapeutic it is to have one of these treatments. But yet I'm seeing this wound healing response and these growth factors being triggered and this cell regeneration occurring. So it's not something that you would normally align. Normally when we look at a trauma treatment, it's not very comfortable to have done in clinic, or sometimes we may even need to use some topical lidocaine, which is like a topical anesthetic, to make the procedure so much more comfortable. But that's not the case with the TCA peels. So the best way I can describe the TCA peels is like a soft signaling to the skin. Now, any of you who've been following me for a long time know that that is exactly how I approach skincare. It's all about the daily consistent habits that lead to great things gained slowly over time. When it comes to skincare, and I'm going to ask you, please don't reach out or think that the answer lies in one laser treatment or even a course of laser treatments or a course of IPL, or most definitely in a syringe, because it doesn't. It's what you do every day. It's those daily whispers to your skin. And then you can go into clinic and have more of the kind of trauma treatments or wound healing response treatments, or the gentle kind of shout at the skin to incur all this intercellular communication. Now you might say to me, well, who exactly is this peel for? And really, it's for everybody. It's anybody who wishes to augment their skin and augment the results. The TCA peels that we offer at Monica Tolan, the Skin Experts, are so gentle and, like I said, have this soft signaling approach that there is no trauma really in having them done. There's no great downtime in having them done, and they suit all skin types. What we will say to you is, and I've always said this, for best outcome, your skin must be healthy going in, as healthy as possible going into this treatment. And you will know that there's only one way to have optimum skin health, and that is to use a molecule called vitamin A. Now, I don't mean a very harsh, aggressive acid form of vitamin A. I want you to look at a fat soluble and a photoprotective form of vitamin A. So to have one of the TCA peels in our clinic, you must be using Environ Skincare, because they work with fat-soluble, very gentle, non-irritating forms of vitamin A that you can use every morning and evening, but most importantly, photoprotective forms of vitamin A. These products are not making your skin more light sensitive. In actual fact, they're protecting your skin from UV damage. So by doing that, we need you to be using Environ Skincare for a minimum of 3 weeks. And quite honestly, you are the greatest beneficiary of that, because you are going to get the better outcome because of that. And then we'll bring you in for treatment. So with the TCA peels, like I said, it is a soft signaling to the skin, and we would recommend a course of 6 peels. So we would preferably do these weekly and possibly even every 10 days. What will happen is we will do the treatment, and then when you fully recover from one treatment, we will be ready to do your next treatment. That's usually in about 7 days. So what happens when you have a TCA treatment at Monica Tolan's? Well, first of all, it is the most amazing facial. So my clients so far don't want to get off the bed when the treatment is over. They literally are so incredibly relaxed, which is quite wonderful when you think of the catalyst of events that we have triggered in that hour. So you're going to come in, and of course we're going to do a really deep cleanse for the skin. We're going to use our pre-cleansing oil, and we're going to use our clay mask to get rid of any cell buildup. We want as much absorption of this peel as possible. We wanted to have nothing blocking its way, because we need that soft signaling to occur. So we're going to do a deep cleanse, and then we're going to remove any residue of cleanser by using our glycolic toner, and now the skin is prepped to have a TCA peel. So we're going to decide at that point which peel we're going to go for, and that really depends on what your goals are and what what outcome you're hoping for from the treatment. So there are 2 different types of TCA peels. There's both a cream and a gel, and the gel is going to absorb deeper into the skin because it has more water in it than the cream. So it's going to that water is going to evaporate when it hits the skin, and it is going to sink slightly deeper into the skin. And what's going to happen then is we're going to apply one layer of that peel, and once that layer has completely dried and evaporated off your skin, it has completed its work. And then at that point, if your skin is giving us the signals to say it would like another layer, we will go ahead and do another layer. We'll do minimum 1, 2, maximum 6 layers. So during this time, the skin is just looking really, really beautiful and really, really glowy. You as a client are very, very comfortable throughout. You might get a little bit of tingling, and that's absolutely fine. Now your skin after layer 2, layer 3 may start to give us some signals to say that it has reached an end point. And if this is your first peel with us, we will probably wrap the treatment up or the peel up at that stage. And we don't need to neutralize this treatment. It is a self-neutralizing peel. So once we remove it off the skin will naturally return to its natural pH and be very, very comfortable. And then we're going to use some vitamin A. We're going to use some AVST gel from Environ Skincare, and we are going to use some microcurrents to push that vitamin A as deep into the skin as possible, because we want it to give all those vital skin health messages to the skin. Bearing in mind that the skin is a lot more permeable now because you've had a peel. Now, if you have a problem skin, acne, rosacea, we will then look at using the cream. And this is actually quite fascinating, and I'm going to show you the results of one of my acne problematic skin clients after just one treatment, bearing in mind that one treatment is only 1/6 of the outcome, because this peel is divided into 6 parts. So we will look at using a cream, and the cream has less water in it, so it's going to sit on the surface of the skin. And it, in sitting on the surface of the skin, it's going to sit on the surface of the skin for anywhere from 10 to 20 minutes. It is going to trigger a cascade of messages in a downward spiral into the skin. And what it's doing is triggering growth factors. And it's also encouraging an intercellular communication response within the skin. Because within the skin's factory, there's many, many different types of cells. And what's really important is how they communicate with each other. Just like any army, and I always consider the skin to be an army because its primary function is defense. And just like any army, there's many different roles, soldiers carrying out different roles within that army to do the job effectively. And what's really important is how they communicate with each other. And that's exactly what these peels do. They cause this kind of downward communication, which is going to trigger a growth factor response. So it's going to trigger an immune response. So your skin is going to get slightly stressed. And what that says is we must produce more collagen, we must produce more growth factors to make sure that Karina or whoever the client is healthy and is okay. It's just that slight, very, very slight stress on the skin that releases this type 1 collagen, which is what we want for a smoother, more hydrated, more healthy skin. And it's also going to rehabilitate scarring as well. So then with the cream, again, like I said, we're just going to remove it with wet cloth, and at that point it will self-neutralize, and we will then go ahead and use this ideal opportunity to feed the skin more of that vital molecule for health, and that is vitamin A, as well as many, many antioxidants. And we will again use our microcurrents. All of this is so incredibly comfortable and incredibly relaxing for the client. So what can she expect in the days, or he expect in the days after a treatment? Well, you know, you're going to leave us with your SPF on unless it's nighttime, and we're going to cover the skin in vitamin A and antioxidants and apply our SPF if it's during the day. And then your skin's going to look amazing. And a lot of my clients the next day are telling me their skin is absolutely glowing. You never get that sandpaper feel. You might feel a little bit dry. And actually, I was out last night and I had my second TCA peel on Wednesday, and last night was Saturday. And when I was washing my hands in the toilet, I looked in the mirror and there was a little bit of flaking all over my skin and my chin. But my skin felt glorious. And that's what I'm loving about this treatment. More so than when any other trauma treatment like microneedling or like Glaze MD or even like more aggressive peels, you kind of feel, I'm going to say rough for about 5 days. You know, you don't really feel yourself. And quite frankly, I don't like when my skin doesn't feel good and doesn't feel healthy. I don't like when it's tender to touch. I don't like when even facial movements and expressions, I can feel this kind of tightness or this sandpaper feel, but it doesn't feel like that with the TCA. And again, that is down to its very gentle approach and the fact that we have taken this peel, divided it into 6 parts, giving your skin a chance to heal and to not even heal, but basically, when we do the peel, we're sending a message to the skin for this cascade of events to occur. And we're going to give the skin 7 days, roughly 7 days, for all of these events to happen. And then just when they've all occurred, and now your skin soldiers, if you wish, are beginning to relax again and chill out, then we bring you back into clinic and we do your second treatment. And then we get all those growth factors back up and running again, doing all their job, which of course is going to give you the most beautiful, healthy, youthful appearance to your skin. It's going to be, if it's a case that scarring is your goal, we're going to build new skin tissue by the release of collagen into the skin. If it's a case that to kill inflammation in the skin, that sterilization element will have occurred in the peel, and then the skin will rejoice in all of the skin immunity Langerhans cells telling the skin to be healthy again, and the skin will respond in that way. Like I said, we're only new to this treatment. We're only working with it maybe 3 weeks, and already I have a client reach out to tell me that she's had more of a result after one of these treatments, bearing in mind that one is only 1/6 than she had in one response of other treatments. So yeah, the TCA is absolutely blowing my mind. Really, it is for, normal kind of health things like diabetes, because obviously we need to be sure of your healing. If you do get cold sores, that's fine. We can cover the area where you're prone to cold sores with some neutralizing products so that the peel never hits off that, because sometimes a peel can trigger a cold sore. But anyone else, like rosacea clients, acne clients, they are perfect candidates for this treatment. And like I said, in my client who's already within a couple of days of having treatment had a tremendous response. You can see the effects of this peel on your skin. We are very, very excited in clinic to be working with this treatment. We're so excited to have this beautiful health enhancing treatment available to our clients so that we can bring their skin journey to a new level. Bear in mind that when it comes to having treatments with us in clinic, it's like we pick you up where you're at in your journey and drop you closer to your goals. We are never exclusively dependent on treatments in the clinic. We believe that you do at least 75% of the work at home with your nutrition and with your topical nutrition, which is of course your skincare. And then we bring you into treatment, and because you're doing all this work at home, we can take you where you're at and drop you closer to your goals. And that's exactly what's going to happen with the TCA peels. So like I said, we have a brilliant offer on in clinic at the moment, but it's only on till the end of November, called Get Cute, where if you buy 3 of any treatment, you get a 4th free. So this is the perfect time to jump on your TCA and get this offer. But we also have buy a course of 6 treatments and you only pay for 5. So buy for 5 treatments and you get your 6th treatment free. And that is continuous at Monica Tolan's across our 3 clinics. You can avail of that treatment, and it is the perfect treatment for, it's a perfect offer for the TCA, because then you're committing to the 6. Now you might say, oh Karina, I live so far away from clinic. Well, what I'd say to you is try and find an Environ stockist closer to where you are and ask them for the TCA peel. It is a stunning, stunning treatment, and it would be incredible for you to have done for your skin. I did it on my sister, who is my guinea pig for everything, and we did 1 treatment on her and she was blown away with the results. What my clients are saying, which is quite unique to a peel, is that they love the process. They love having it done in clinic, and they enjoy the downtime. Their skin always looks and feels really, really good. Yes, they will see that little bit of cell giveaway, enough for them to know that they had a treatment, and also they'll start to see that glow kick in, but it's not in any way kind of, making you feel like, oh my God, I don't even want to go out today. My skin is feeling tender and sore. You just don't get that. So kudos to Dr. Des Fernandez. But with Des, he has worked with those phenol peels. He's worked with TCAs at a much lower pH and a much higher percentage, where they're a lot more aggressive. And he has said that the outcome is not worth that level of trauma. But whereas he has found that with this, there's no trauma to the skin, there's no downtime really, but a little bit more patience is required, because we're doing it over a course of 6 treatments, but the outcome is well worth it. And again, you must, albeit that yes, the skin is an organ, it is the largest organ in the body, and it is the only organ really that we care for it in an aesthetic way. We must also remember that it is an organ, and we don't want to stress it out or traumatize it. And it is so important that no matter what we ask of it, that we are keeping it healthy and feeding it the right nutrition, both topically and orally, to allow it to do its primary function, which is of course to keep you healthy. It is of course defense. So yeah, that's the TCA peels. I am super excited to see you in clinic. I want to hear all about your experience when you do. I want you to let me know what you think of the results. I can tell you now, this treatment is standing out from the crowd. Like I said, I'm almost 30 years in the industry, and yeah, I do get excited about treatments. I wouldn't bring them into the clinic, quite honestly, if I didn't. But I don't know when or if ever I have got as excited about a treatment as I have the TCA peel. Like I said, the outcome is so beautiful. I feel like I'm getting such incredible benefits. I haven't put my skin through any stress, and having the treatment is an absolute joy. It's a pure pleasure to have. And we need that mental switch off and that relaxation as well. And what I'm noticing with my client is they're committing to the 6 treatments. They love coming in. They're enjoying the hour on the couch as well as the benefits too. So book yourself in for a TCA course at Monica Tolan's. Like I said, we have clinics in Balbriggan, Malahide, Dublin. Head to monicatolan.com for more information. And if you are listening to this before the end of November, make sure you grab that Get Cute, because that is the most savings, but we will have the 6 treatments for the price of 5 ongoing. Thank you so much for tuning in to today's episode of Skin Deep by Karina Tolan, and we will catch up soon. Until then, make sure you enjoy all the benefits of my discount code with LusoTan, who are our sponsors and without whom these podcasts would not be possible. So Skin Deep 20 is the code. Head to lusotan.com and you will get to make to avail of all those savings. Until next time, you take care, and I look forward to hearing from you all soon.